Tonight we are in for an engaging and informative presentation about the COVID-19 vaccine for children aged 5 to 11 years old, provided by two wonderful doctors, Dr. Henry Ukpe, a local pediatrician, and Dr. Thomas Piggott, our new Medical Officer of Health for the Peterborough region. Please note this session is being recorded and will be available on our YouTube channel for your reference after the event, or of course you can share that link with others. So before I get to introductions, I just want to extend our sincere thanks to you, our viewers, for joining us this evening. We know how precious your time is as parents and grandparents and caregivers, especially at this time of year. We are grateful for your participation and your keen interest to learn more about this important vaccine for children from the medical experts. Thank you for all the questions that you have sent us. We have gathered them so our doctors can answer each one after a brief overview of the vaccine this evening. So on that note, it's my great pleasure to introduce the two doctors who you'll be hearing from this evening. So let's start with Dr. Piggott. Dr. Thomas Piggott is our new Medical Officer of Health here at Peterborough Public Health. And Dr. Piggott brings extensive experience working at various levels of public health in Canada and internationally. Most recently, Dr. Piggott served as the Medical Officer of Health in the northern region of Labrador-Grenville. And prior to working with Labrador-Grenville Health, Dr. Piggott worked as a field doctor with Médecins Sans Frontières, the Doctors Without Borders, in the Democratic Republic of the Congo. Dr. Piggott is a public health and preventative medicine specialist and a practicing family physician who completed his master's in public health at the London School of Hygiene and Tropical Medicine and residency training at McMaster University here in Ontario. Previously, he has served on the board of directors of the Public Health Physicians of Canada and the World Federation of Public Health Associations, and currently sits on the board of directors of the Canadian Public Health Association. Here, I should have just advanced that. There we go. So we also have the privilege of welcoming Dr. Henry Ukpe. He's just held up, and I hope he'll be joining us a little later. And he's here with us this evening as a local pediatrician and a fellow of the Royal College of Physicians and Surgeons of Canada and also of the American Academy of Pediatrics. He is also an active member of the Canadian Pediatric Society and is widely published in electronic and print media. And welcome, Dr. Ukpe. That's great to see you here. He was awarded the Certificate of Merit of the Canadian Pediatric Society for outstanding contribution to youth in his community and nominated for the Royal College of Physicians and Surgeons of Canada 2015 Prix d'Excellence Specialist of the Year Award for British Columbia, Alberta, Yukon, and the Northwest Territory. So with that, I'd like to throw it over to Dr. Piggott to start us off this evening. Go ahead.
Good evening. Thank you, Brittany, and thank you to everyone that's tuned in so far. And we're hoping we'll get many more people joining and people who will be able to watch the recording later. So thank you again for coming, and thank you for sending questions. Very much looking forward to this session with myself and Dr. Ukpe tonight. So Brittany, go ahead to the next slide. Tonight we're going to be speaking about COVID-19 and the benefits of vaccination. We're going to talk about how these vaccines, including the mRNA Pfizer vaccine for 5 to 11-year-olds, work. We're going to talk about the current situation. We'll talk about the pediatric vaccine and answer some more questions in detail. And then we've gotten lots of nice questions to help, explore this topic and answer your questions, quell your anxieties, and hopefully convince you of what we both believe, which is that this vaccine is extremely important for your children. So we can go to the next slide here. You probably know this now that we're nearly 2 years into this pandemic, but the virus that causes this illness, COVID-19, is caused by the SARS-CoV-2 virus. There are now multiple variants, and Brittany, if you just advance the slide there, those include the Delta variant that's been around for a while, but also, and very concerningly, is the new Omicron variant. There's been over 5 million deaths around the world now and over 250 million cases of COVID-19. We can do lots to prevent this illness, but the most important of these things is vaccination. And we'll go to the next slide here, Brittany, to talk about generally the benefits of getting vaccinated. You know, without the vaccine, your body doesn't know what the virus looks like and isn't able to protect yourself nearly as well as if we deliver the vaccine, and you're more quickly able to identify the virus and mount an immune response, clear it, and become healthy again sooner. On the next slide, there's a picture of how this vaccine is working. So a small little piece of harmless material, I like to think of it like a recipe card, is delivered into your body by the vaccine, and that recipe card teaches your body how to respond to COVID-19 without actually giving it the virus. So this tiny little bit of mRNA, it's called, shows it a portion of the spike protein, it's called. And on the next slide, Brittany, you can see that then allows your body to learn how to recognize and respond to the virus. And then ultimately, if you actually are exposed to the virus later, your body will quickly recognize that same spike protein and be able to destroy it. You may never even feel sick if you are exposed to the virus. On the next slide, Brittany highlights the current situation. And what I want to highlight most of all is that we are seeing an increase in the number of cases of COVID-19 in children that are 5 to 11-year-old. And those would largely be still children who haven't gotten the vaccine yet. More broadly, we're seeing an increase in cases, which is concerning, as well with the newly emerging Omicron variant, which you're hearing lots about in the media now. The number of cases are increasing and will likely continue to increase quite concerningly as we approach the holidays and into next year. But what we're seeing is that the vaccine is really effective. People that are vaccinated have a way lower risk of getting the illness, but even more importantly, have a way lower risk of getting very sick and having to go into the hospital or be admitted to the ICU. On the next slide, Brittany, you can see the graph that shows just how many cases in the past 2 weeks have been in 5 to 11-year-olds. It's now a significant portion of our cases in the largest group. So as much as, you know, some parents may be thinking, should I wait and see? Should I really get my child vaccinated yet? I want to share the message that yes, now is the time to do it, because we're seeing a very concerning rise in cases in this group. And so now is the time to get vaccinated. On to our next slide, Brittany, we have a picture here of another tool. Vaccines incredibly important, but this year schools will be sending school children home with rapid antigen tests that can test and detect if your child has COVID-19. Instructions will be coming home with this test, and we have information that we'll be sharing as well. But essentially, it's going to be recommended that every 3 to 4 days over the break, one of these tests be completed on your school child. And it's a really helpful tool so that we can try to stop the spread of COVID-19, as well as stop the spread when school starts again in the new year. On to the next slide, a little bit about the pediatric vaccine. It's a special vaccine that's been designed with a lower dose, with about a third of the dose of the vaccine. And the reason that's the case is because for children, they have a stronger immune system, and with even less vaccine, they're able to develop just as good immunity. And one of the benefits of the lower dose is that we can see less risk of some of the side effects, which are rare to begin with. On to the next slide. I'm going to now call over to Dr. Ukpe if you'd like to speak a bit about, you know, the efficacy and safety, and share some of your wisdom as a pediatrician who's practicing here in the Peterborough community.
Thanks, Tom. I'm sorry I logged in late. I ran out of the hospital. I told somebody not to have a baby, that I had this appointment. They just ignored me and had the baby anyways. So I had to.
These things can't wait, eh?
Yeah, they didn't listen to me at all. But thanks for the opportunity this time.
Thank you.
Many of you are my patients. We've talked about this already. As Dr. Piggott had said already, the why we have to give vaccines to children this age group of 5 to 11 is simply that the incidence, the amount of illness in these children have increased. COVID has been in 4 waves since it started. And the last wave, the highest incidence of disease was in children of this age group, 5 to 11. They are not usually as sick as older people are, so they can have a flu-like illness, they can run around and you don't know that they're significantly ill. But you don't want your child to be that 1 or 2 children that end up in ICU, because the long-term effects of COVID, we are still beginning to learn about it. Now, there are other measures you've been used to, washing your hands and mask, but vaccine has been proven to be most efficacious in preventing this disease. It is very effective. If you take 100 people and give them these vaccines, 9 out of 10 of them will either not have the infection, or if they have it, they will stay out of hospital and they will have very low amount of illness. Another thing is that they won't have the usual rate of transmitting the illness to older people. So their grandparents are safer around them when they have the vaccines. The vaccines are very well tolerated. Many of you had asked me whether there is myocarditis or pericarditis. The number that was used to test this vaccine did not show any incidence of pericarditis or myocarditis. And that is more common in people that are older than this age group. So one can be reassured that they're safe. There are minor side effects. It includes having a sore arm. You can be tired. Some children mount fevers, and they can be irritable, and that's about it, actually. There's not been reported any significant or serious side effects. The children who have had COVID-19 can and should still be vaccinated because the vaccine will boost whatever immunity they have had previously from having COVID-19. That's number one. Number two, we at this time are not sure how much immunity, how long the immunity lasts, either from the vaccine or from the natural illness itself. So it becomes important to have more than 1 dose. Next slide, please, Brittany. Hello?
Sorry, I'm just having a challenge advancing the slides.
Okay.
Oh, another user took control. Sorry, I just have to.
All right. All right. Benefits of the child getting vaccinated. The benefit is that children are at risk, and we don't know the long-term consequences of their having the illness. There are many consequences that have been reported. Some of you have asked me things like fertility, ability to have children down the road. Those things are not likely to be the case. I have chosen the words not likely, not because I'm not sure. It's because I know that there are a lot of people on the internet that are making all sorts of claims. Children, women of childbearing age that had the vaccine compared to those who did not have the vaccine, there is no difference in the fertility of those studied in the United States. The Delta variant may pose a higher risk of illness for children. We don't know enough about the Omicron to know how significantly it may impact people, but we know that the transmissibility is quite high. It's quite easy to get the Omicron virus. When a child is sick, it's disruptive to everything. They cannot go to school. There is social isolation for the child itself. I've had many children that have come to talk to me about having increased mental stress, either anxiety, depression, just because they have been isolated for so long. Reduced activities outside the house is not good for them. It impacts their physical well-being. And all these things can be prevented by just having the child immunized or vaccinated so that he can move around. The vaccine has worked very well in clinical trials to prevent children from being ill. Next slide, Brittany. Your child becomes the weakest link if you don't vaccinate your child. Viruses are living things. They want to survive. When they spread in a population, they preferentially find the weakest link, the place that is not vaccinated. The child that is not vaccinated becomes the weakest link. So if everybody around your child's school or daycare is vaccinated and your child is not, if they are sick, your child is likely to be the sickest of them. Next slide. Now, how do you get your child ready to be vaccinated? I can assure you that children listen to the news these days and they hear all sorts of things about COVID and are understandably quite frightened about what they hear. Talk to them. I normally just tell them it's not different from the shots you've already had. And it is important, not only so that you're not sick, but you get to visit grandparents, you get to go to school, and you get to be part of a community of people that are trying to fight the disease. They will certainly know that, let them know that they will feel a pinch at the poke site, and encourage them to ask questions. When they are going to have the vaccination, what you could do is to wear a short-sleeve shirt. Even if you have to wear a thick coat outside, you wear a short-sleeve shirt and under. I normally tell the parents that if the child has reacted to vaccine in the past with a painful arm or a fever, you can give the child Tylenol 2 hours before the vaccine, because that's the peak time in which the Tylenol will kick in. Practice rolling up their sleeves and showing them where the injection may actually be. It is very comforting for most children to sit on the laps of the parent. You can hold them, you can distract them, you can talk to them, you can whisper to them. My wife normally sings to our children, whatever something painful is going to happen. So now when they go for routine immunizations for everything, they say, sing for me, mom. So that's something you can practice and do quite well. Next slide, please. You should help your child stay relaxed. Many children can tell when their parents are anxious. So you may want to try and get them to stay relaxed. Take a few breaths, pretend to blow a candle, do whatever it is to distract them. Small toys are good, headphones are quite good. A little book can go a long way. And in my family, iPads and Toy Stories and everything do go a long way to keep the peace around here. So though the Canadian Pediatric Society says you shouldn't allow tablet times, and don't tell them, but allow my child watch things on the tablet because it allows me to be sane. So if you have a tablet or a small phone, take it with you and put on one of those things they like, and it will distract them. Next slide.
All right, this is back over to me. Thank you so much, Dr. Ukpe. So if you are looking for an appointment, a couple of these dates have passed, but we still have lots of vaccination appointments available, and we are increasing the availability of those appointments. So the best to do is to just visit our peterboroughpublichealth.ca website, and you can see there our appointment availability and how to get your vaccine. There are a couple other ways that we mentioned on this slide here as well. And on to the next slide, and I think we have our first question that has been submitted to us from a 5 to 11-year-old, and we wanted to hear directly from kids because they're the ones that might have the questions. So, Brittany, please go ahead and play our first question.
My brother is 3. When will he get his vaccine?
Oh, thank you so much for that question. So the question was, my brother is 3 years old. When will he get his vaccine? I imagine there are lots of kids out there, and maybe some kids listening, who have a younger sibling that is not yet 5 years old, and they will get their vaccine soon. We know that the vaccine we have now is not yet authorized for under 5-year-olds, but one of the priorities is getting this vaccine for younger children. And the companies that make the vaccine, as well as our organization in Canada that looks out for safety and makes recommendations on vaccine, is closely monitoring this. So as soon as there are new studies that have been done and we know that it's safe, it will hopefully very soon be available for your little brother. Okay, next question. Thanks, Brittany.
How much is this? Can I bring my stuffy?
Oh, good questions. So the first one was, how much is the shot going to hurt? Dr. Ukpe, I think you said a little bit about it already. Generally, I say it's just like a little pinch, but any other advice for this little one?
It's not going to hurt more than removing a sliver from your hand or any of those things. And yes, you can bring your stuffy. And we may even give your stuffy a little needle also if you want.
Oh, is it authorized in stuffies? I don't know.
Yeah.
But yes, I definitely think it's important to bring your stuffy.
Yep, we can work on something.
We should petition to get it authorized to protect stuffies as well. Yep. I think you could even bring 2 stuffies. Now, Dr. Ukpe, how many stuffies do you think is too many stuffies to bring? I don't know.
No, it depends on how many stuffies you have and right. How many that your mom would let you bring. Usually your mom would tell you how many you should bring.
Okay, that's good. Well, look to your mom or your dad, and hopefully they'll give you some advice on that. That's great. Okay, we've got lots more questions left. So the next question that we got, children are at lower risk of severe COVID-19 than older adults. So why should children get the COVID-19 vaccine? Dr. Ukpe, do you want to start with this one?
Yep. As I said earlier, the COVID-19 has come in waves. And the last wave, which was the fourth wave, the children 5 to 11 had the highest incidence of disease. And it makes a mockery of everything else we are doing if we don't deal with the disease in that age group, because even though they are not sick, they will serve as a reservoir to infect the rest of the people. And older people that have had the vaccine will, the antibodies they've gotten will wear off. And those children can become a source of infection to everybody, and they keep propagating the infection. So that is why it is necessary for children to have the vaccine. That's number one, as part of members of the community. But as individuals, children can be very sick themselves. Though many of them are not sick, they have very mild disease when they have it. But a few of them that are sick are significantly sick. And you don't want to be one of those few that end up in ICU with a sick child for something you could have prevented. I can tell you a story here because it's important. I had a patient, it didn't have to do with COVID, but in those days it had to do with meningitis. She didn't want the child to have meningitis vaccine, but in process of trying to prevent the child from having the vaccine, the child ended up having meningitis with significant complications, including the fact that the child was deaf and those kind of things. She felt very bad for a long time. And she confided that all she was trying to do was the best for her child. And so I understand many people who are reluctant to give their children vaccines, that I do understand you are trying to do the best for your child. But from the information we have right now, the best is to give your child the vaccine rather than take the chance of the child having COVID infection.
Thank you so much. Great answer. Okay, our next question on the next slide, Brittany, is what is the efficacy of the vaccine in 5 to 11-year-old group? So, you know, the study showed over 90%, about 90.7% efficacy in the trial, and that was in the study. And most importantly, there was no people in the trial. So even though it didn't quite stop 100% of people from getting COVID-19, there was none that were vaccinated that then got severe illness and had severe challenges with it. So this is actually, as things go, a pretty good vaccine and is very obviously important. And go on 2 slides ahead, please, Brittany. The next question around, does the vaccine protect against the new variant? Because I think this question is linked to this. And the reality, like Dr. Ukpe was talking about a bit earlier with Omicron, is that we don't know for 100% sure how good this vaccine will be. We know that the vaccine has been good with new variants in the past, including the Delta strain, and we believe that the vaccine will be helpful, even if it is less effective. We believe it still will be very helpful against the Omicron variant. And the thing is this is moving very quickly, and you know, we don't want to wait and see and wait a month, because then your child would not be protected in that time. Certainly, because the vaccine is very safe, we think it's a very important protection in the context of Omicron. Back to the last slide in question about the time between the first and the second dose. The reason is we've now discovered with months more research that for this vaccine, if we wait 8 weeks in between your first and your second dose, it will be more effective. So that's the recommendation from NACI, the body that looks at recommendations around vaccines. And if you go now 2 slides forward, the question, which I think is good for you, Dr. Ukpe, was, are there heart-related risks or risk of a myocarditis with the vaccine?
So far, we haven't found any because the number of patients that were tested, it wasn't enough to, they did not find any complications that would relate to the heart, either myocarditis or the pericarditis. And it has been suggested from review of a lot of data that the incidence is likely to be even less in people this age group, partly because the dose of the vaccine is smaller than you have in people who are older. And I read something not too long ago about the fact that the chances are lower the more it's highest in the first one. But if you don't have it that first time, the second dose has a lower chance of a complication. So far, from the data we have, nothing suggests that a child will have myocarditis, but it is a reasonable question and concern given that people that are older than children have had myocarditis, but even in those groups, it was considered rare.
Yeah, very rare. No, that's great. Thank you, Dr. Ukpe. Next question. Is if my 11-year-old gets the pediatric dose now and is turning 12 before the second, will she get the pediatric or the adult dose for the second dose?
Okay, Karen.
Yeah, no, and so if they are turning 12 before they get their second dose, they'll then get the adult dose.
Yeah.
Next question. Are there specific conditions in youth which we should maybe be cautious for, or may mean that they can't get the vaccine? Do you want to start on this one, Dr. Ukpe?
Yes. Somebody who has active myocarditis or active pericarditis, the vaccine should be delayed. It doesn't mean you cannot give it, but it should be delayed until that condition is completely resolved. Any situation where there is proof that the child can have significant allergy or anaphylaxis, meaning allergy that involves the airways and the blood pressure, those kind of situations, the vaccine should be either avoided or given in controlled circumstances where if such a child reacts, you will be able to do something about it. Those are the 2 situations that come to my mind. Now, many people have, sorry?
That's okay. Go ahead.
Many people have asked me about chronic conditions like asthma, like Crohn's disease, and other children who have had chronic illnesses. They, more than anybody else, needs the vaccine because if they are ill, their body being already compromised with chronic illness would find it more challenging to fight without the vaccine. So those are the current thinking about who can get or cannot get the vaccine. Dr. Piggott, you may want to add something.
I was only going to add that if somebody has COVID-19 or the symptoms right then and there, that should be delayed. But if you've had COVID-19 before, you can still get the vaccine. And in fact, the vaccine adds important protection over on top of the infection. We can go to the next slide, Brittany. So question about, is there any data to suggest that girls are not getting puberty or their periods, or could it impact fertility? And I know you spoke a bit about this, Dr. Ukpe, but just drawing from the evidence that the World Health Organization has been looking at around the world, you know, there have been some reports of some people having disruption in their periods after getting COVID-19. But really, with this many people around the world getting the vaccine, that could be just due to chance alone, because some people will develop changes in their period after a vaccine. And there's also no evidence at this time that the vaccine interferes with fertility. And there also is no biological evidence of connection that makes sense that it could later cause challenges with the reproductive organs, looking at how these vaccines work. So we don't think that this will be the case. We are monitoring, and the World Health Organization and Health Canada are monitoring the data very, very quickly and closely, but still to this date, there's no evidence of either of those concerns. Anything you would like to add on that, Dr. Upe?
No, I had already said that actually that has in terms of fertility, this has been looked at because there are many people that go onto the internet and say whatever they like. Fertility has been looked at. A study was done, controlled, where the incidence of fertility was monitored within two groups of people, one that had vaccine and one that didn't. And there was absolutely no difference in the rate of fertility. And I can tell you in my office that I see the impact of getting people who have been vaccinated and locking them inside the house, which is part of why we have so many babies. We call them vaccine babies coming out all over the place now.
I may or may not have two of them.
Yeah.
Next slide. What side effects should I be looking for? Well, I think we answered this question earlier, Dr. Ukpe, but what side effects should we be looking for? What's normal and what would be alarming? Did you want to answer this one?
Yes, the side effects to look for is sore arm. You can have fatigue, sore muscles, and just general exhaustion. You may have fevers. Those are fine, regular, expected side effects. The one that will be alarming is if the child had generalized rash, like hives all over, and has difficulty with breathing or has a drop in blood pressure. Those would be very unusual. And apart from having to be reported, you should take that child to be seen by somebody as quickly as possible. And the potential side effects will be within 24 to 48 hours, just like in any other immunization as you see.
Thank you. That's great. And next question. Will places start requiring youth to be vaccinated? If you go to the next slide there, Brittany. So at this time, public places do not require youth under the age of 11 and under to be vaccinated. Currently, the vaccine requirements are only for 12 years and older. But we don't know what this will look like in the future. It would be in consideration of people having access and being able to get the vaccine on evidence of the transmission of COVID-19 and a better understanding of variants, including Omicron. So at this time, it is not a requirement. It is just highly, highly recommended. But we don't know if that will change and impact things like school, daycare, sports, or activities in the future. On to the next slide, Brittany. And yeah, so a couple other questions that we've gotten in general. One question was, my child is turning 12. My child is turning 12 soon. Should I wait and get them the adult dose vaccine? And my message to that is, please don't wait. This vaccine is effective and available now if your child is above 5 years old, 5 years and older. And what is most important is getting protected now or as soon as possible. So I think that brings us to the end of the questions, unless you've been able to see anything else, Brittany. Dr. Ukpe, I'm not sure if you have any other messages or anything you'd like to share.
No, I don't have any. I was going to ask you though, if somebody is 11 years old, but he's a big guy, like 80 kilograms size, which is equivalent in size to an adolescent, what dose would you give him?
Well, at this point, I would still recommend the 5 to 11-year-old based on age, because the vaccine is not weight-based. It's actually more based on age and how old your immune system is. So the reason that the dose is lower for under 12-year-olds is because we know they have a more active, sensitive immune system that will respond quicker and faster. So even if it's a big person, you're best to stick with the age group that it's authorized in. Yeah. Same goes for then adults getting the vaccine. Even if somebody is bigger, we still give them the same dose because it still gives them just as much protection through immunity with the vaccine.
Yep. I needed you to reinforce that based on a conversation I had with one of the people I know is listening tonight.
Oh, good. Well, that's good. I appreciate you bringing the questions. Yeah. I'm hearing from Brittany that we have lots of thumbs up on our YouTube channel, so lots of appreciation, but no more questions that have come in. So I think with that, we will finish our session, but we are still here and available. And if there's more questions, I'd love to hear from them. I know Dr. Ukpe, I'm sure, would as well. And we can you can send them to this email and we can make sure we'll get a response to you. So with that, I think I'll say a big thank you to Brittany and Carrie, who've helped us produce tonight and help us be here with you this evening. And a big, big thank you to you, Dr. Ukpe, for joining. It was very enjoyable, as it was the last time having you here and learning from you. I appreciate this partnership, and I think those listening appreciate seeing a local pediatrician and expert also participating. So thank you.
Thanks for the opportunity. I'm very grateful.
All right. Bye, everyone.
Bye.